Am I audible now?
Yes, you are audible.
Mr. Balaji sir, is it open for our delegates?
Yes, ma'am. Yes, ma'am.
Okay.
Good morning. I have great pride and privilege in welcoming all of you for this monthly edition of the Tamil Nadu chapters webinar of the Society of Vaginal Surgeons of India, Tamil Nadu chapters webinar. And I have great pleasure in requesting President PMG sir to introduce the speaker. PMG sir, please.
Good morning, our chief guest, Dr. Vasudev Panikar, our secretary, office bearers of SAUSI, and dear audience. It has been a great privilege of monthly interaction with you all. On this month, we have a unique person who has been our guest speaker, and he is from Kerala, Kodungalur, Thrissur. Very interesting personality. And he has passed his MBBS and he belongs to the 1973 batch. And after that, he has done his anesthesia, and then he did his master's in anesthesia. Then probably just like another eminent person, Das Gupta, who has done anesthesia and then switched over to surgery and then to gynae. The same way he has switched over to the gynae. And not only switched over to a gynae, he started his own place and then started doing on all the innovations, sitting in a very small place with a 30-bed hospital where he has been producing excellent clinical materials and scientific materials and surgical materials. Besides all this, he has been so helpful. And in one situation, when I was just telling one of the person who's in periphery happens to have a PPH, and she was trying out all the desperate measures. I told her use a Panikar's balloon. So she somehow managed to use it. And then after 3 hours, she had a doubt. She called up Panikar directly from Hosur. And then she said, this is the situation. So he helped her out immediately and then advised her what to do. And then she tied over the crisis. And then she was so happy. She said, you not only introduced Panikar's balloon, but also Panikar to me. That's the kind of a person he is in helping others. Here, he is with us to share his knowledge on his inventions in obstetrics and gynecology, especially contributing to the vaginal surgery. Over to you, sir. We are very, very happy and we are pleased to meet you.
Very good morning to everybody. Thank you, Dr. Govinath, for this great opportunity given to me. I am very grateful to all the members and Dr. Govinath, because I am a smart person. I am not an academician, even though I am a pretty elderly person with a little experience in obstetrics and gynecology. I don't do much great things, only routine obstetric and gynecological procedures, where I have made certain innovations, both in procedures and also in instruments. And some of these instruments are really life-saving and cost-saving, much more safe, tension-free, and first, not only in vaginal surgery, I will show vaginal surgery after some time. I will show the instruments that I have innovated. First, if possible, I will show those instruments also. I will show the slides. Then I will show a few videos as the time permits. You can ask me any question, I will answer, because I have got a reasonably good experience in these things. I am working alone in a small hospital. So all difficulties I have, I am able to tide over. So I will share my experience. I am from a small place called Kodungalur. This is my Kodungalur Devi temple. It is mythologically very, very famous place. This temple is supposed to be built by Lord Parashurama. When Parashurama threw his axe into the Arabian Sea to reclaim the land of Kerala, he made 4 temples to protect this land. This is one of the temples on the western side. On the southern side, it is the Kanyakumari temple, that's called Balambika temple. On the eastern side there is the Hemambika temple, and on the northern side is the Mugambika temple. This is the mythological story. So, Kodungalur, it was known as Musiris in the ancient days, and this was the most important port city of India near the Arabian Sea, nearly 1,500, 2,300, 3,000 years back. So, all these foreigners came to Kodungalur first came to India through Kodungalur first. Jews came 3,000 years back. The first synagogue is in Kodungalur. Christianity came first to nearly 1,800 years back. The first church is in Kodungalur. And also Islam came nearly 1,400 years back to Kodungalur. The first mosque is also, that is Chairman Mosque. At that time, Chairman Perumal was the ruler. It's a Tamil ruler, Tamil dynasty, because all these places were under Tamil Nadu in the earlier days. This history you should know because we are all same people. That's why I said. This was the ancient port city of Kodungalur last. We had trade relations with almost all the places in the world. Thomas Alva Edison, king of inventions. Everybody knows. He was my inspiration even from the school days. He has made more than 1,000 inventions and 1,000 patents to his credit. I have made few innovations, nearly 30 innovations, and I have nearly 10 patents to my credit. These are my innovated instruments. I will come into it one by one. These are my innovated procedures and surgical techniques. We will make in India. That's my motto. This is the PPH cannula I have made. This cannula can prevent and stop postpartum hemorrhage almost by 100%. It can be introduced into the uterine cavity when you suspect PPH. So the bleeding will be minimized. Maybe 10 or 15 ml will be the bleeding after a vaginal delivery. It can be used in cesarean section also, during cesarean section, or when you have a bleeding, you can use it after cesarean section also. I have all the videos, but today I will show only vaginal surgery. This is the instrument that has helped all the obstetricians. This is a very simple instrument, very inexpensive. Introduce this instrument and connect to a suction machine, and the question of PPH is finished. This is another instrument that I have made. This is the super bipolar forceps, because this portion is made of silver. So the efficiency is uncomparable. Anything can be coagulated, or everything can be coagulated with this. I have made this in this shape because it's the most ergonomical shape. I have patented it also. So you can go very deep into the vagina, deep into the pelvis, deep into the abdominal cavity. Anywhere you can go and coagulate. You can even coagulate and divide. I am doing NDVH with this. I will show that afterwards. Any surgery, an open hysterectomy, cesarean section, whatever is there, any bleeding you can stop with this. I will show this after some time. This is another forceps I have designed. This has got two curvatures. This is one 90-degree curve and this is a 60-degree curve. 90-degree curve is available in the market, but after introducing this 60-degree curve, the utility of this instrument has enhanced maybe 100 times. You can use it as an aneurysm needle as well as a tissue separator and a tissue retractor. I am doing NDVH, then PPH surgery, PPH hysterectomy, placenta previa hysterectomy, or uterus saving surgery in placenta previa. All these with I use it for a hemostatic suture in those situations. I do cerclage also with this. This is the unbreakable safety blade knife I have innovated. This is the instrument. If you introduce a blade into this handle, the blade will not break again. So, see, this is a broken blade. You can see this is a broken blade. You introduce into this, the blade will not break again. So this can be very, very useful in modulating big fibroids vaginally as well as abdominally, and this can be used by all surgeons when you are dealing with a hard tissue. The blade will not break off, and the tip will not be lost in the peritoneal cavity or in the tissues. I had a catastrophe when I was doing a modulation using an endo knife. The blade was broken and lost in the peritoneal cavity. I had a very bad time. It took 2 days for me to retrieve that blade, and then I decided to make an unbreakable blade. Then I made this. This is patented, and there's no, I searched everywhere in the literature, there's no such blade available in the international market. This is unbreakable safety knife. Handle also is made ergonomically, so you can hold it very firmly when you are modulating hard tissues like fibroids. Both angled and straight forms are there, both are there. This is the lighted vaginal speculum. This is the success of all my obstetric and gynec procedures because if you introduce a fiber optic light cable into this, you will get plenty of light inside the vagina, or you can use it as an abdominal retractor also. For vaginal surgery and all procedures in the vagina and on the cervix, this is very, very useful. This is quite inexpensive. Only thing, you have to have a fiber optic light source and a cable, which is also, we can get a cheaper version. I am using all this for the last 15 years. See, you see this light, you see, plenty of light you will get inside the vagina or in the abdominal cavity. Okay. We can see this. This is the radical DNC cannula I have innovated. And you can see the ordinary curette there, but it is very, it is not very effective in doing total curettage of the entire uterine cavity. But if this has a longitudinal 6 slits, 8 millimeter cannula, you introduce the cannula into the uterine cavity, connect it to a section, make a negative pressure of nearly 200 millimeters of mercury, and then you rotate like this. These are reasonably sharp edges. This will divide the endometrial tissue. Even if it's a polyp, it will divide endometrial hyperplasia, whatever it be, even abortion, whatever the tissue will be divided and sucked in. It will give a radical curettage of the entire uterine cavity. Moreover, this can be used in AUB also. If the bleeding is in excess and you cannot control, you introduce this cannula and connect it to a section and make a negative pressure of 700 millimeters of mercury, immediately the bleeding will be stopped. I have a lot of experience. Even I have saved the patient from the verge of dying. So just introduce the cannula and connect it to a section, the bleeding will be stopped in AUB, cervical pregnancy, as well as in scar pregnancy also. I have experience in all this. This can be used for radical curettage as well as to control AUB. This is how it works. Introduced in the uterine cavity, then connected to a section, and then the entire uterine cavity will collapse onto the surface of the cannula under pressure, and the bleeding will be stopped due to the pressure effect. This is another instrument that I have innovated. This is to hold hard tissues. It's a non-slip bulldog forces. Here you can see the teeth is arranged like this. The lower jaw is inside the upper jaw. You can see this one, just like the alignment of our teeth. That is the principle. So if you hold a hard tissue like a fibroid, or even when you are doing hysterectomy, hold the cervix, the tissue will not slip because it will give a bite like this, like this. This is the pedicle clamp. This is the pedicle clamp. This I use for vaginal hysterectomy when I am doing using bipolar. I hold the pedicle like this, vascular pedicle or vessel like this, then coagulate and divide, and after checking only leave it. This is the ripening device I have innovated. This can be used to ripen the cervix or induction of labor. This is very, very useful. There's no other instrument available in the world like this. It's far, far better than the double balloon of that is available in the international market. Cook's double balloon. It's far, far better, and predictable dilatation will be there within 2 to 3 hours. It is very useful, especially when there's a second trimester abortion in a previous cesarean section where you cannot use misoprostol or something like that. This will give definite 3 centimeter dilatation. This is how it is being used. Through this instrument, introduce a Foley and inflate the balloon like this, and then pull on the Foley and fix on the handle of this instrument. So there's a pressure effect on the cervix with the distended Foley and this instrument, because the cervix is sandwiched in between the two, and the cervix will dilate very fast. Predictable, 100% predictable result you will get. This is the laparolift screw I have designed. This is for doing gasless laparoscopy, as well as when you do vaginal surgery in very obese patient under spinal anesthesia, where the patient may find difficulty in breathing because all the abdominal muscles are paralyzed, and the weight of the abdomen will fall on the viscera, so the diaphragm cannot move. So if you lift the abdomen, the patient can breathe easy. This principle I am utilizing in all my obese patients. You can operate on patients like this if you use a laparolift screw. This is how it is being used. This is a very obese patient, 94 kilo, where I am doing vaginal hysterectomy for that patient. See this. This is the new instrument that I have designed. This is endometrial ablation device. This is the device. Dilate the cervix to 10 millimeters and introduce this instrument and connect it to a bipolar energy source. And this is the electrode tip, and you can rotate or move like this, and the endometrial cavity will be coagulated. So in AUB, where there's no other pathology, this is a good option where you can avoid hysterectomy. Especially for the poor people, this is a very good option. I don't have much cases, so still I am trying it. I have used it in 4 or 5 cases, and all of them got relief. I have to make a big trial because cases are very few. Still I am trying. I will show the video if time permits. These are the small instruments that I have made for mini laparotomy or ultra small incision laparotomy for doing hysterectomy, ovarian cystectomy, etc. But I'm not showing this. This is for anesthesia. So in the case of the PPH cannula, this idea can save millions of lives. This now I will show a case of NDBS. in which I am doing NDBH using the super bipolar forceps in a way that I have shown you. I will show how I am doing NDBH. You under spinal anesthesia, I am doing NDBH. After anesthesia, position the patient, pull down the cervix with a bulldog valsalem.
The cervix is pulled down.
There's audio, you can hear it.
The wall along with the bladder is dissected like this using the super bipolar forceps. I am dissecting slightly deeper onto the cervix, so there is no thermal.
Can you hear the video?
Yes, yes.
Okay.
To the vaginal wall or to the bladder, not even a drop of blood will be lost. Now, bidigitally palpate the uterosacral complex and isolate it with the PUL forceps like this by piercing from anterior to posterior. This isolated mecanthroid uterosacral complex is thoroughly desiccated with the super bipolar and divided. The same procedure is repeated on the opposite side also. Now, pull down the uterus and open the pouch of Douglas. Very easy to open the pouch of Douglas like this. Now, hold the cervix with the panicles, non-slip bulldog forceps and pull down. Introduce your left index finger into the pouch of Douglas and isolate the right uterosacral ligament and coagulate it like this and hold it with the panicles, pedicle clamp and divide it. It contains the uterine artery. You can see the divided tip of the uterine artery. Coagulate it thoroughly well and release the clamp slowly and leave it. The same procedure is repeated on the opposite side also. Now you can see the UV fold. It's a previous cesarean section. The scar is there. Divide the scar and open the UV folds. Bisect the uterus and pull it down and hook the right corner structures with your index finger and isolate again it with the PUL forceps. This contains the ovarian ligament, round ligament, uterine artery and the fallopian tube. Coagulate it thoroughly and hold it with the panicles, pedicle clamp and divide it and further coagulate it and then you can leave it. You can see the divided tip of the ovarian artery, coagulate it thoroughly well. The same procedure. Now, morcellate the uterus and pull it down. You can see the 4 centimeter fibroid and the 5 centimeter intracavity fibroid also. This is a 16-week uterus. Pull it down. Now you see the opposite corner structures. Hold it with the pedicle clamp, coagulate and divide the super bipolar thoroughly. Now, transfix the uterosacral complex with the vaginal wall and close the wall. This finishes the hysterectomy, equal to total laparoscopic hysterectomy.
Actually, I don't have this removal of adnex vaginally using the bipolar. I could not record it properly because I didn't have cases. Because of the COVID situation, I didn't have a suitable case coming for that one. Otherwise, I would have shown that also. Adnex can easily be removed using the bipolar because you coagulate on the mesosalpinx and the meso-ovarium and isolate the ovary and then hold on to the infundibulopelvic ligament with the pedicle clamp and then divide it and coagulate it. Very easy to remove vaginally. I will show this animated version of this NDVH using the bipolar. If you are interested, you can see that also. All these videos are there in my collection and in the YouTube also it is there.
This animation shows steps of a very simple, safe and inexpensive method of non-descent vaginal hysterectomy for all indications without blood loss and postoperative pain. The steps are equal to total laparoscopic hysterectomy but done vaginally using very simple instruments invented by me. These are the main instruments used for this surgery. This is a super bipolar. Any tissue or any vessel can be coagulated and divided with this. This is useful for all surgeons for all surgeries. This is a PUL forceps used to isolate the tissues. This is a pedicle clamp used to hold vascular pedicles. This is a lighted vaginal speculum used for all gynecologists for all purposes. This is the non-slip bulldog forceps, can be used to hold tissues. This is the unbreakable safety knife used to divide tissues. The cervix is held with the non-slip bulldog forceps and pulled down, and the anterior vaginal wall is dissected and up with the superbipolar. Scissors can also be used for this to reach the UV fold, and the UV fold is opened, and the lighter vaginal speculum is introduced under the anterior vaginal wall, and the speculum introduced at the side, and the McEnroe uterosacral complex is identified and isolated with the PUL forceps, and then it is divided with the superbipolar after thorough coagulation, like this. The same procedure is repeated on the opposite side. The McEnroe uterosacral complex is isolated and coagulated and divided like this. Now the cervix is pulled down and the pouch of Douglas is opened. It can be opened very easily at this stage using the superbipolar, or you can use the scissors also. Insert a speculum in the pouch of Douglas also. Then insert your index finger and isolate the rest of the uterosacral complex and isolate it with the PUL forceps and hold it with the pedicle clamp. Then coagulate and divide it. This contains the uterine artery also, like coagulated and divided like this on both sides. Bisect the uterus using the unbreakable safety knife and take it out. Now transfer the uterosacral complex with the vaginal wall and close the vault. This finishes the hysterectomy. That is equal to total laparoscopic hysterectomy, but done vaginally.
I'm not doing any urogynecological procedures, and I'm not using mesh also. So those innovative procedures I cannot present. But for ordinary prolapse with the PFR, I'm doing like this. Not even a drop of blood will be lost. You can try this technique of this NDVH technique in prolapse also. And till now, I didn't have a wall prolapse or any complications with that. But I don't use mesh because it's a small place. If some complication arises, I cannot manage it. So all these complicated modern procedures, I'm not doing. Now I will show you cerclage also using this PUL force. After that, according to your choice, I will show 2-3 videos also. I am using this PUL force that I've shown you for cerclage. I have animated version as well as a surgery also. I will show the surgery. Friends, I am here demonstrating a new method of doing cerclage using this PUL force innovated by me. This is modified Shirodkar technique I am doing. It can be used as a needle as well as a needle holder. The suture material is True-Bond from Sutures India Company. Kindly see this. Cervix is pulled down with Alice forceps. 2 cc of adrenaline saline is infiltrated like this. And then the anterior vaginal wall is incised using Panicate's unbreakable safety knife, and then it is lifted up with the Alice forceps and further dissected using scissors like this. You can dissect up to the UV fold. UV fold is reached. Now take the suture material. This is True-Bond from Sutures India Company. At the tip of the PUL forceps, it is held, and bidigitally the uterosacral ligament is palpated, and onto the uterosacral ligament at the center,
the PUL forces with the suture material is pierced from anterior to posterior to reach the posterior fornix. The tip of the forces open and the suture material is pulled down. The other end of the suture material also held with the PUL forces, and the procedure is repeated on the opposite side like this. On to the uterosacral ligament at the center, it is pierced to reach the posterior fornix. Tip of the forceps open and the thread pulled down, and the thread is tied as high as possible and as tight as possible in the posterior fornix. You can see the tape on the cervix very neatly placed. By using this PUL forceps, you can place the suture at the desired height. Now, suture the undervaginal wall with the cervix and the surgery is finished. Thank you.
Now, other procedures, if you are interested, I will show 2 or 3 procedures, like using the PPS cannula in vaginal delivery as well as in cesarean section. This is the most useful but it's not part of vaginal surgery. That's all. If you are interested, I will show the video.
Yeah, you can go ahead. Go ahead, Panikar.
2-minute videos.
This is the PPS cannula innovated by me. This is 30 centimeters in length and 12 millimeters in diameter with multiple holes. This can prevent and stop PPS with almost 100% success. This is made of stainless steel. This can be used forever and it costs only 800 rupees. So inexpensive, and it will save all our mothers from bleeding from the postpartum uterus due to any cause. And this is useful even in DIC and patients with PAH. Kindly use it. This is quite inexpensive, costs only 800 rupees. See how I am using it. This is a case of severe PPH. I am using Panikar's PPH suction cannula to prevent and stop PPH. Introduce the PPH suction cannula into the uterine cavity by palpating the anterior lip of the cervix and then the internal loss. Make sure that the cannula has reached up to the fundus. Then connect it to a suction machine to make a negative pressure of 700 millimeters of mercury. The blood collected in the uterine cavity is sucked out first, and the wall of the uterine cavity will be strongly sucked onto the cannula, and the pressure of suction will stop all the bleeding, and 30 minutes is allowed so that all the bleeding will be stopped by the pressure of suction and clot formation. This case was severe bleeding, so I put the cannula before suturing the episiotomy. And this is very comfortable and convenient to suture the episiotomy if you put the cannula before suturing them, because there will not be any bleeding from inside the uterine cavity, and you can very comfortably suture the episiotomy. This is a breakthrough invention to prevent and treat PPH with almost 100% success. Total blood loss in this is nearly 200 ml. Thank you.
Now I will show you how to use the PPS cannula during cesarean section. Suppose you are doing cesarean section on a patient with placenta previa, and after taking out the baby, take out the placenta, exteriorize the uterus, and immediately you can introduce the PPS cannula like this, and then hold the edges of the uterine incision with 3 or 4 Alice forceps and close it and start suction. This can be done within 1 to 2 minutes, and then the uterus will be contracted and the bleeding will be stopped. Then only close the uterus with the Vicryl. I will show that how I am doing it. This is a many gynecologists are doing like this nowadays to save the mothers.
Friends, I'm here demonstrating how to use PPS suction cannula during cesarean section. Keep a PPS suction cannula connected with a silicone tube like this, water glued and ready. Please see the video. Exterior the uterus like here. Don't suck or wipe the uterine cavity. Hold the lower edge of the incision, uterine incision with the 2 Alice forceps and then insert a dilator through the holes to check the patency. Then introduce the silicone tube which is already connected with the PPS cannula like this, which will go into the vagina, and an assistant can pull the tube down through the vagina and connect it to the suction machine. It's gone down, then like this, introduced into the uterine cavity and make sure that the cannula has reached up to the fundus. Now, hold the edges of the uterine incision with Alice forceps over and like this. Immediately you can start suction and you can see the uterus contract. Started. See the uterus is contracting, it has become pale. It's stony hard now. So in whatever the cause of CPHD, even in placenta previa, you can, after removing the placenta, you can do like this and the patient will be saved. See, it's stony hard. See the rugosity and start suturing like this and close the uterine incision. There's a uterine incision after suturing. Now we can put the uterus inside the abdomen. Lift the loins and put inside the abdomen.
I have got many useful videos. Surgery for placenta previa without blood vessels after putting a hemostatic suturing. This is the picture of that hemostatic suturing. How to put that hemostatic suturing. This anybody can do, even the periphery without even facility for blood transfusion. We can do and save the patient. All these are obstetrics videos. I'll show you an animated picture of the video of that one for better understanding. So very short video.
I am demonstrating a special suturing technique for uterus saving surgery in placenta previa accreta type 4 without blood loss. Transverse uterine incision is made above the level of the placenta and the baby is delivered. The placenta is left undisturbed. This is the PUL forceps invented by me. It has a 90-degree curve at the tip and a 60-degree curve behind. This can be used as a thread carrier as well as an aneurysm needle. This is the postpartum uterus exteriorized. The uterus is pulled anteriorly to expose the UV fold. UV fold opened and bladder pushed down like this. 2 pieces of number 1 vehicle, 50 centimeter in length, is taken at the tip of the PUL forceps and it is pierced from anterior to posterior side, just above the bladder at the center of the cervix to reach the posterior side like this. And the tip of the forceps open and the threads are pulled out and the forceps is taken back. One thread is taken to right side and the other is taken to left side and tied on either side as low as possible and as tight as possible. This will occlude all the blood supply to the uterus, including the ovarian vessel, uterine artery and its branches. You can see the uterus becoming pale and the vessels are getting shrunken. Now you can proceed on to hysterectomy or uterus saving procedures. And when completed, you can remove the hemostatic suture and check for any bleeding and close the abdomen so that the ovary will regain its blood supply also. Only thing that you have to use is fuel forces for quick, effective, and successful completion of the surgery.
I will show you one more interesting video. This is the rapid ripening device I have innovated. I have told you this is very, very useful for induction of labor. Even in IUD, it's very useful. I will show that animated video also.
This is the soft silicone autoclavable and reusable cervical ripening device invented by me. The Foley's catheter is first introduced through this device and then into the extra amniotic space through the cervical canal, and the bulb is inflated. The sponge here represents the cervix. The Foley is introduced into the extra amniotic space like this, and then the bulb is inflated with 70 ml of saline and pulled down. The cervical ripening device is introduced through the vagina to press on the cervix like this, and the Foley's catheter is pulled down with force and fixed onto the side hole of the ripening device like this. So the bulb of the Foley and the ripening device exert a pressure effect on the cervix, which is sandwiched in between these two. This pressure will dilate the cervix like this, and when the dilatation is complete, the Foley's catheter, bulb, and the device will slowly falls down through the vagina. This is very useful, very effective, very inexpensive technique of induction of labor.
I have two more videos, and I have recently I have innovated one instrument. This is the cervical dilator. You under anesthesia, you introduce this dilator into the cervical canal to pass the internal os. Make an assessment of the cervical canal using a sound, then use this one. Then you press on the body of this instrument, the tip will dilate little, expand, and then you rotate it, the cervix will be dilated. This is very, very useful to dilate the cervix. When you want to, especially when you want to dilate the cervix more than 8 or 10 millimeters, for introducing hysteroscope, or even for doing DNC, this is very useful. We have to change and make improvements in our practice, safety as well as convenience in our practice. Excellent device. I will show a video of this along with the video of the endometrial ablation device, if time permits. If interested, I will show that one. It will take nearly 7 minutes. Shall I go for that?
Yeah, please go ahead. Please go ahead.
Friends, this is the new bipolar endometrial ablation device innovated by me. This can be introduced into the uterine cavity after dilating the cervix using the Panik's rapid cervix dilator. and then a current of 60 watt is applied, and this can be moved inside the uterine cavity like this, side by side also, to and fro also, rotated also. Then the whole of the endometrial cavity will be desiccated. I have tried this in many hysterectomy specimens, keeping the specimen in my hand and desiccated, and there is no temperature coming to the surface of the uterus. And then I have tried it in many hysterectomy cases where I did desiccation, and after hysterectomy took out the uterus and divided and checked it. It gives excellent desiccation. If it is tried in a big center, this can be of very much help to all the women who is suffering from AUB without any other pathology. So this will have a very great impact in the society by reducing the blood flows to the females also. Surgery could be avoided in many of these patients with the AUB. I have not given this instrument to anybody. If somebody wants, I can send it to them and they can have, do a big trial and propagate this. This will be very useful for the society because a lot of cost saving is there, and this is a very inexpensive instrument. I will show the videos of uterus which I have desiccated. I will cut open it and show you. Kindly see it. Thank you very much. This is a case of severe dysmenorrhea and menorrhagia. She is for non-descent vaginal hysterectomy using superbipolar. Before doing vaginal hysterectomy, I am trying to do endometrial ablation using the bipolar endometrial ablation device. For that, I am dilating the cervix with the new cervical dilator. Introduce the cervical dilator and just press on the body of the dilator. Then the tip will expand and then rotate clockwise and anti-clockwise few times. And the cervix will be dilated very easily, even up to 1.5 centimeters. You can see the nice dilatation of the cervix. It's a relatively hard cervix. It's an 8-week size uterus with an intramural fibroid and an endometrioma and adenomyoma. See this? It is getting dilated. After dilatation, you check the dilatation with a 16 number Hagas dilator. Yes, I am checking with the Hagas dilator. Then assess after sucking and cleaning of the blood, assess the length of the uterine cavity again, and the length of the endometrial ablation device is adjusted so that it will not go beyond the fundus of the uterus. Then it is introduced into the uterine cavity and a bipolar current of 60 watt is applied, and then the endometrial ablation device is rotated clockwise and anti-clockwise few times, sideways, and to and fro movement is also done so that the whole of the endometrial cavity will be desiccated. You can see thoroughly you can desiccate it. You can move to and fro and sideways also so that the whole of the endometrium will be desiccated. And this is a trial I am showing because this patient is for hysterectomy, but I want to know whether the desiccation will be complete using this device. Yeah, almost the desiccation is over. You can see the movement of the bipolar endometrial ablation device. So you can see smoke coming. It is a perfect desiccation. You can get it. After doing hysterectomy, I will take out the specimen and divide this, cut open the specimen and show you how it is working. This is the specimen that I have taken out after bipolar hysterectomy. You see the endometrial cavity, it is thoroughly desiccated. There's no danger because I have tried in another uterus in many times in hysterectomy specimens, whether the current, the temperature is coming to the surface or not. It will not come to the surface of the uterus. See the endometrial cavity is thoroughly desiccated. On this side, there is adenomyoma. You can see the adenomyoma there. That's the adenomyoma.
Yeah, that's the adenomyoma. On the other side, there's an intramural fibroid also. This was the cause of her menorrhagia and dysmenorrhea for this patient, and hysterectomy was done using the superbipolar forceps. This is another case where I have done hysterectomy for her using the superbipolar again. It's an 8-week size uterus. She had menorrhagia and dysmenorrhea, and ultrasound showed fibroid polyps and multiple fibroid polyps and intramural fibroids. So after taking out the specimen, I am introducing the endometrial ablation device and coagulating it. After thorough coagulation, I am holding it in the hand. There's no temperature coming to the surface of the uterus. I want to check it. That's why coagulated like this. I am cutting it open, and you can see the desiccated endometrial cavity. Yes. See, there's a fibroid polyp and a fibroid inside the cavity. It is also being partially or fully desiccated. Endometrium is thoroughly desiccated, and because I was holding it in my hand, I can make sure that there was no temperature spread to the outside of the uterus. And this is a very good option for avoiding hysterectomy in AUB when there is no other pathology. You have to confirm that there's no malignancy there, but it's a very inexpensive device. Only thing, I have only few patients, and I'm having a smaller setup. It has to be tried in a big center, and then it will be helpful for the for a lot of people suffering from AUB, and surgery could be avoided, and even anemia could be avoided. Lot of suffering could be avoided with this simple device. Quite inexpensive. I have not given to anybody.
Thank you, Dr. Panikar. Thank you for sharing all your experiences with our audience here. I think it's open for questions. Anybody can then unmute and ask the questions to Dr. Panikar. Srikala, if you have any questions in the chat box, you can also think. Unmute yourself.
I saw Vidya madam asking for how to re-sterilize, whether the ripening instrument by Dr. Panikar, he told us it was reusable. So
Yeah.
she had raised a query whether it is to be autoclaved or what.
It is autoclavable because it is silicone. It will not get damaged.
Okay, okay.
For many times. Can be used forever rather.
Okay, okay.
Another advantage is there, madam. It can be used as an adapter for this PPH cannula or even in MR cannula. When you don't have the small size tube in the operation OT or labor room, this can be used as an adapter because this will give a good airtight fitting. Very useful. Even there's a DNC cannula, radical DNC cannula, everything can be fitted onto this.
Sir, I mean, though not for marketing, I would like to know what would be the cost of the of each of your humans. Even tell us roughly.
I will send you the brochure because
Okay.
it's not. I am just taking only the making charge. This ripening device is 1,000 rupees.
Okay.
Even the mold itself costs 3 lakhs rupees for me to make that one.
Okay.
It's only my passion.
Vidya madam again has asked us what are the temperature settings when you do for AUB when you're trying to cauterize. What is the temperature setting you are doing?
It is 50 to 60 watts, 50 to 60 watts, bipolar current.
Okay.
He's also asking when will you stop? What's the time?
That that according to our judgment only, because we are doing it blindly. You coagulate for 4 or 5 minutes, then coagulation will stop it. So because once the endometrium is coagulated, the coagulation will not spread to the surface because the tissue becomes dry. then current will not pass.
When we all of us here in the audience are passionate vaginal surgeons, but we are very much used to putting the clamp, cutting, ligating that in our blood. So, and ligature is a little more costly. So, just wondering if what you are saying is really cost effective, because the idea we are all very passionate about. We like, because we'll definitely save time.
See, cutting and suturing is the gold standard. There's no doubt. But innovative ideas are there. There are instruments made by the good companies, which just like my instrument, it can be utilized and vaginal hysterectomy can be done. Dr. Purohit is doing with another instrument made by a company, just like this only. But this is very inexpensive, locally made, and this will last for a lifetime. Many doctors are using it. Maybe 500. Many are done even more than 500 cases with this one. One Dr. Pindaria from Gujarat has taken it 3 years back. He is a fan of this instrument. And moreover, this one of the major advantages for all surgeries. If you use it, you will become addicted to one, because you need not have to suture any bleeder. You just touch it and forget it like that. For tubal sterilization, I have all the videos, nearly 40 videos in a pen drive. If anybody wants, I can send it to you just for the making charge, because it costs nearly 700 rupees for me to make these videos on a pen drive. Pen drive itself costs 450 rupees, then the making charge and packing charge and things like that. I have a book also on these innovations. I can send the book also along with that if you want. These are the list of my videos, nearly 40 videos. Most of them are really useful, really useful. Some are not up to the standard, but 90% of the videos are really useful. It will make your day-to-day practice much more comfortable. Any doubt, you can call me. Even people from abroad call me even in midnight. I will answer. There's no doubt. This is my passion. I told you in the beginning, I am a very small person. God made me like that. So I have to be like this. Till my efficiency lasts or my memory lasts.
I can see the passion in you, sir, and we would like to emulate and take up a few of your suggestions and even get the video from you, so that what we were able to see in this 1 hour period, maybe we can go through it again and again and make it as part of our regular schedule, because all the surgeries which you have shown are our day-to-day procedures. They are not extremely rare procedures or any robotic surgeries which is difficult to emulate and do it in a day-to-day practice. The ones which you have shown are ones which we are doing. So I think we will be able to improve and take it into our day-to-day practice.
Madam, this PPH cannula, if you use it, your life will become entirely, you can go home and sleep in the night. No need of any, any fear of PPH or the patient getting bad or something like that. Even the nurses are doing it for me.
How long do you apply the suction in PPH cannula, sir?
Usually 30 minutes. But if it's a difficult case, like even in DIC, I have done 2 cases, referred from government hospital nearby. I kept it for 10 hours. In between, I gave 2 or 3 fresh blood and the patient became all right. Last month, I have a case of DUB that also came from outside. The patient had only 5 grams hemoglobin and the bleeding was she came in the midnight. It was coming like water. It was thin blood because of the bleeding. I put the cannula, that radical DNC cannula, bleeding stopped immediately. But when I took out the cannula next day morning, again the bleeding restarted. They wanted hysterectomy. So with the 5 gram hemoglobin, I did hysterectomy for her using my bipolar. No blood transfusion was given. She was given only iron infusion and sent her back.
With 5 grams?
Yeah. It is possible, man. It is possible. I am not boasting. It is possible. Everybody can do. I told you, I am a very smart person. If I can do, everybody can. I have only a DGO. My obstetric qualifications only a DGO.
I was just wondering with 5 grams hysterectomy whether it will
I
be.
am spinal. I did.
Dr. Panikar,
Yes.
see, I did my DGO. And after that, I was in anesthesia for 1 year. Then I came back to the MD. Most of my surgeries got refined when I was an anesthetist seeing others operate.
Yeah, that's the
So,
many inputs we get. Many inputs. Because I
exactly,
have worked with many
exactly.
surgeons, many gynecologists, even thoracic surgeons. So we will get many inputs.
Yes. Thank you very much, Vasudev Panikar. And it's your innovations. I always recollect my professor, Dr. Palniyappan. He will ask me, why did you take up gynecology? So when I was just trying to put up all the answers, he always used to tell me how he has chosen. No, he will say the normal marriage, conception, and then delivery, all of them are physiological phenomenon. No woman should die of a physiological phenomenon. If there is a death, equally 50% the man is responsible, but he is happy sitting at home. So he said, I would like to contribute my best to bring down the mortality in this small way. And you have done it.
Thank you very much. It's a great honor that you have given me.
Yes, Rikalam.
Thanks a lot. I would really thank our faculty, Dr. Vasudeva Panikar, who has been kind enough to show us all the videos and give us tips and tricks, and also has agreed to send the videos, which many people don't do, and even the book. We are really greatly indebted to you. We would definitely try to follow whatever you are saying and help in the improvement of our women, which is our passion overall, whether it is obstetrics or gynec. We promise we will do it, sir. I sincerely thank PMG sir for bringing Dr. Vasudeva Panikar to this monthly webinar. It was really excellent, and really this was a webinar which we can do in our day-to-day practice. Thanks a lot to all the delegates who have joined us. In spite of having another webinar of the IAGE, we have had many people logging in. Thanks a lot. And then our sincere thanks to the Shield Pharma, Mr. Balaji, who always is ready to sponsor our program. And anything else, sir, PMG, sir?
Yeah, we will announce about the next meeting soon.
Yes, sir. Yes, sir. So thank you. Thank you. And
Thank you, Panikar. Keep safe.
Thank you very much.
thank you, sir.
Okay.
Thank you, Balaji.